Hi everyone, Dr. Timothy Gallagher here again at Maragal Medical. This week we're going to be talking to you about peripheral neuropathy. I know in the field of medicine, oftentimes a diagnosis of neuropathy can be awfully confusing. And this week, our medical director, Dr. Michael Marciello, will be talking to you about what neuropathy is and the exciting treatment options we have here at Maragal Medical. Take it away, Dr. Mike.
Neuropathy. What is neuropathy? Well, if we take the word pathology in the nerve, and that's what we think about when we consider neuropathy as a diagnosis or at least a terminology that we need better explanation. And here at Maragal Medical, we want to make sure you understand your problems and we can help treat it, identify it, and diagnose it in a correct manner. But neuropathy is a very difficult thing to think about in relation to the general person's understanding. We think about neuropathy as, well, damage to the nervous system and for a diabetic. And diabetic peripheral neuropathy is a very common problem for people with diabetes. But what's happening? Well, the high sugar content in the aspects of a person's diabetic results in damage to the peripheral nerve, and it causes burning and tingling and discomfort, perhaps loss of balance and loss of ability to maintain position sense or so-called proprioception. So we need to think about neuropathy. We need better explanation. Well, some of you may remember some basic anatomy and basic science of nervous system. The central nervous system is our brain and our spinal cord. It controls the body's nervous system from the central core. Well, the peripheral nervous system is what we usually talk about when we think about peripheral neuropathy, and that's all the nerves that come out from the spinal cord, extends to our arms and our legs, and really can have wonderful control to our body's motion, to our mechanisms of feeling, cold, temperature, the touch sensation, and our position sense. The peripheral nervous system is so important for us, we need to make sure it is working well. But when you have pathology in the nervous system, and particularly the peripheral nervous system, we are looking at a very detrimental and disabling problem. If you are losing the nerve function from your foot, extending up into your ankle or above, we may not know where our foot is in place. We may stumble more, we may lose our balance and trip. And we start getting neuropathic pain. And we want to make sure people understand that there is a difference between the neuropathic pain that comes with neuropathy and neuropathy itself. Neuropathy doesn't have to be painful. It may be just more loss of position sense and touch sensation, but it may be disruptive at night. Many people out there, you know who you are, that have neuropathy in the bedtime. Your foot gets more burning sensation. It gets irritable. You can't quite get comfortable in bed. Many times jumping out of bed to get some motion so you can get back to sleep and get some comfort. Neuropathy is a very common process we see exposed at night. And there are many causes for that, but to make it simplistically, we need to make sure we understand the nervous system works all the time, throughout the day. We may go to sleep, but our nervous system is still working. So if we have pathology in the nerve, we need to help try to suppress it. The difficulty in standard medicine nowadays, though, is we're mostly symptom-based society, and we're trying to just suppress that burning sensation or nervous system problem. If we think about taking a medicine for it, well, those medicines can come with side effects, and those medicines may result in not much help. But there are some medicines that I can prescribe, and we can look at trying to suppress some of those symptoms. But we want to get to the root cause. We want to look to see really where is that neuropathy coming from, or is the diagnosis correct? It could be coming down from your back, causing numbness in your feet. Well, that's not technically neuropathy. That would be a word we call radiculopathy, or what you know as sciatica. Nerve gets aggravated at the back, extends down to your foot goes numb. Well, that's commonly one side. Peripheral neuropathy is generally a systemic problem. It affects both sides rather equally. In fact, if it gets so severe, it can involve your fingers. because the points furthest away is where the nerve has its most deficit. It dies off at the fingers and toes first before it produces more problematic areas above your ankle, for instance. There is actually a problem that we've called tarsal tunnel syndrome that's like carpal tunnel syndrome. That's a focal nerve entrapment that could be a so-called focal mononeuropathy, not a generalized peripheral neuropathy, but that needs to be identified correctly, because we don't want to say, hey, this man has peripheral neuropathy, when in fact it's an entrapment at the ankle and affecting just one part of the foot. Peripheral neuropathy has many causes. Diabetes, I've mentioned. Alcoholism, if you're exposed to too much alcohol, you can cause the nerves to be damaged. You can have an infectious process, such as Lyme disease. The aspects of developing Lyme disease results in damage to the tissues, one of which is the nervous system. You may have a systemic inflammatory process, such as rheumatoid arthritis or lupus, and those conditions make you more susceptible to have breakdown of the nervous system. And then there are idiopathic reasons, things that we just don't know, and we want to try to identify those so we can then at least start treating you to improve your symptoms and eventually improve the problems. We want to prevent your back from having problems, we want to prevent the falls, and we want to regain your ability to function. So we want to get you on our balance machine to actually improve upon your balance, because the perception of your foot may not be great, but your muscles at the upper leg can make up the difference, and we need some structure and we need some strength for that. Our chiropractors can work with our laser and use the class 4 laser to get some blood supply into the foot and ankle, and hopefully again improve upon the nerve symptoms. We can use our physical therapy, of course, to work our balance and work on aspects of mechanics to compensate for the improper walking mechanisms that your body will just occur to happen because the nerve doesn't work well. And I would look at you from the top to bottom and say, what's the cause? Where's that neuropathy coming from? And is there a way to improve it? Can we get rid of it? For instance, I can run some blood tests. If you have a low vitamin B12 level, for instance, B12 deficiency causes neuropathy. However, by supplementing it back, you can cure the problem. If you have diabetes, it's a progressive problem, so we need to make sure we control your diabetes well, and through integrative nutrition and through the health and wellness of our practice, here at Maragal Medical, we're looking at all those factors to make sure the wellness is important just as much as the individual diagnosis, and that may in fact reduce your neuropathy problem. We are looking at it from all angles. We want to get you better from top to bottom. So folks, when you have peripheral neuropathy or been told you have neuropathy, don't be satisfied with someone say, sorry, we can't really help you, but I could give you some medications to make the symptoms try to get better. We can really look at it from a more holistic approach, get the body moving with our chiropractors, getting the proper diagnoses, getting some blood work, working nutrition and exercise through our therapists, and we are going to take care of you collectively. We work as a team. We will address the issues of making sure your diagnosis is correct. We don't want you to suffer from the complications of peripheral neuropathy or the diseases that may cause it.
Thanks, Dr. Marciello. Wasn't that great information? I think you now all have a better understanding of what neuropathy is and all of the exciting treatment options that we have here at Maragal Medical. Remember what Dr. Marciello said, traditional treatment options for neuropathy only include medication which are going to mask the symptoms associated with your pathology. You're not getting to the root cause of the problem, and thus the neuropathy is progressing. It's getting worse and worse every year. Wouldn't it be great to utilize an exciting treatment option where we're using regenerative medicine to help repair damage to the tissue, as well as incorporating specific robotics technology to work on fall prevention and your balance. Here at Maragal Medical, we're a unique physical medicine clinic where we combine chiropractic treatment, physical therapy, and medical care all under one roof. And best of all, we take most insurances. If you like the information you saw today, please subscribe to our YouTube channel. More information about our clinic can always be found on our website at maragalmedical.com. Folks, your health is your most valuable asset, and you should be able to access that asset each and every day without limitation. Let the doctors at Maragal Medical lead you on a path to wellness. Well, that's it from today. I hope you learned something. Enjoy the rest of your week, and we'll see you again soon. Have a great day, everyone.